Hi, I'm Dr. Mark Schusterman. Today we're going to talk about rejuvenation of the aging face. As we get older, the collagen fibers and the elastic fibers in our skin start to disappear and stretch, and we get sagging of the skin. We also get fine lines and wrinkles, particularly if we have sun damage of the skin. The rejuvenation of the face requires several modalities in order to make it look as good as we can. I like to describe this as a tripod of modalities. The first, of course, is the surgical modality called a facelift. The facelift is used to address the sagging skin in our face and neck. In a facelift, the incision is made around the hair and up into the hairline, both in front of the ear, on top of the ear, and behind the ear. Typically, the incision can go around the sideburn and is made in such a way that the hair will regrow through the incision. The cheeks and neck skin are then elevated in order to tighten them. We also tighten the muscles underneath the neck and in the face. The deep tissue in the face is called the SMAS or SMAS. And this is elevated along with the skin in order to tighten the underlying structures of the face and make it a longer lasting result. The neck muscles are also sutured tight in order to get rid of the bands in the neck and give a more youthful appearance to the neck skin. Therefore, the facelift is used both in the cheeks and in the neck and tightens the skin. It can also be used in conjunction with a brow lift, which is where the brows are elevated by making incisions in the hairline of the scalp, of the forehead. The brows are elevated and usually along the outer side of the brow to avoid the surprised look and give a more natural look to the face. The eyes are also addressed at this time in many patients. The upper and lower eyelid lifts are done at the same time, and there are a variety of ways to do the eyelids. Typically in the upper eyelid, we will remove a portion of the skin in order to get rid of the excess fold of skin in the upper eyelid. There may be some removal of fat, although this will be minimal. Also in the lower eyelid, we will remove some of the skin in order to get a more youthful appearance to the lower eyelid, but basically try to get rid of the trough under the eyelid by repositioning the fat or even injecting fat in order to freshen this area. Also, when we do the SMAS elevation of the cheek, this will also help the appearance of the lower eyelid. Once all these procedures have been done, we need to deal with the texture and tone of the skin, the fine lines, and the sun damage. The way we do that is with a laser resurfacing. The newer lasers have less downtime than the older lasers and are much better at rejuvenating the skin. Typically, we can't do this at the same time as the facelift because we don't want to damage the skin on both sides and leads to problems with wound healing. So after your facelift has been healed for several weeks, we can go back and do the laser, and you can have your typical recovery after that. It usually takes a week to recover from the laser, and again, your skin tone and texture will be much improved. The fine lines around your mouth can be addressed with the laser as well, and the sun damaged spots will go away and be improved with that as well. The recovery from the facelift is typically about 2 weeks. The first week, you won't be able to wear makeup, but the second week you will be able to. There's an overnight stay with the facelift, and the drains will be removed the next day. We've discussed two legs of the tripod of reversing the effects of facial aging, the facelift and laser resurfacing. Now that you've got your new look, how are you going to maintain it? Along on the third leg of this process is the skincare, and we will design a custom program for you to maintain the youthful, natural look that you have. To see if you're a candidate for these procedures or which procedures are best for you, please make an appointment for a consultation so I can design a program specifically for you. I look forward to seeing you.